So we are revisiting this yet again. Yet again, we had that little short period of time where the riots and the protests were breaking out, and the sort of the Modelo virus, right? It stopped. It didn't spread anymore, or more so, people weren't focusing on it. And then a couple of weeks after that's happened, and they slowed down. Here we are back again, another round of everybody highlighting the virus. And believe it or not, somehow, some way, people are saying, or the studies, the experts are, of course, saying that the virus, in terms of its spreading, the protests had nothing to do with that. All right, whatever. But nonetheless, we're back to talking about this. And what I want to do is highlight something, because the ninja bots really had been blowing up my mentions on Twitter. They still are for the most part. But I got an interesting response from somebody, and it was a great opportunity for me to get back to talking about this, but highlight some things that generally aren't going to be highlighted from certainly more mainstream forms of media, because it goes against narratives of apocalyptic viruses and doom and gloom. And, you know, that's good news. Let's say this: good news is bad news when it comes to the guys that are, I don't want to say advocating doom and gloom, but need this to be doom and gloom for the sake of whatever personal narrative. It creates heroes out of people and so forth. So check this out. A guy posts, "No, you're assuming and selfish." This was in response to another guy in my mention. Says, there have been babies, kids, teens, young and middle-aged adults that have gotten severely ill and even died. I've heard this repeated, I don't know how many times, even before. And it's so lazy. It's being dishonest. And I don't understand why people would continue to focus on statistical outliers when it comes to this virus. I did that video talking about Cuomo and others, and how because of they like to say, like, people that advocate against mask mandates, or folks like myself who advocate against lockdowns, are the ones that are responsible for killing people. I would disagree with that wholeheartedly. And the reason why is because when you treat every age demographic the same way, you cannot be efficient with your resources, because everybody can't be everywhere at the same time. And they built a policy, and by they, I mean basically every government in the entire country, for the most part, built policies around treating every age demographic and the health status in terms of demographic the same exact way, even though we knew early on, I was covering this 4 months ago, we knew early on when the earlier numbers were coming in from the other countries that this was a very specific virus in terms of who was more likely to be impacted and who was more likely to be either severely ill, be hospitalized, and more so obviously die. They treated us all the same, and they had these breakouts going on in nursing homes and stuff like that. I believe I was reading something that said like 40% of the deaths were happening in like nursing homes, man. And when you, again, don't dedicate your time and resources, you worried about everybody instead of worrying about the people that are most vulnerable. It should have been the 29, 30-year-olds like myself. It should have been those guys you were focusing on. But I want to go through some data, and I showed this guy, right? I said, more dramatism. Babies, kids, teens, and young adults are statistical outliers. In New York City, per 100K, deaths from the age of 0 and 44 are almost statistically insignificant. And what I'm referencing is this right here. This is right. I'll put the link in the description. You've seen me show this chart before. I believe actually the ages of 18 and 44 actually went down, if I'm not mistaken. But this is just per 100K, right? In terms of hospitalizations, obviously per 100K, the older you get, the more likely you are being hospitalized from this virus. I will put the links in the description. This comes straight from New York City, which is the hardest hit place in this country, considering the population, considering how they live for a multitude of different reasons. It's one of the, it obviously got hit the hardest. And they've done a decent job of collecting data in terms of who's being impacted and so forth. I don't want to get into too much of a dispute about are they cooking the books. I think we already confirmed that they are cooking the books, adding people to this tally. So you got to create it, approach it with just a little bit of grain of salt, right? Because we do know that some books are getting cooked as far as, did they die with it or did they die because of it, right? And so forth. So I remember that video I did about Toronto, for example, and they had just flat out admitted on their public health Twitter, like, yeah, we include people, even if you didn't die from it, even if you died from something else, we still include them in the numbers. It was crazy. But I was mentioning that I also said out of almost 20,000 deaths, only 735 are between the ages of 0 and 44. Only 27 had no underlying illnesses. And this is why it pisses me off so much when we sit up here and you get these doom and gloomers, right? They have to treat this like an apocalyptic virus. This has been a chance for so many corporate media figureheads, blue check marks, corporate entities, not just political figures, but just popular public figures in general, to just signal their tails off. I care so much about people. I want to save people. I want people to die. And that seems to be possibly why people are treating this like an apocalyptic virus, because they can use this as an example to signal, right? To make themselves look good. It's an ego boost, but they're being dishonest if they want to approach it like, well, there's some people that are young that are dying from this. Dude, those are statistical outliers. This is not my opinion I'm arguing here right now. This is what the data says. These are the facts. Okay? So don't be mad at me, because this is just what it reads. So the data that I was referencing here, you can look here, right? These are the confirmed deaths, almost 20,000 deaths in New York City. Actually, I believe it's a little over. And of the confirmed totals, right? You have the total deaths. And this is what I was talking about between the ages of 0 and 44. And I'm willing to bet most of these deaths are between the ages of like 40 and 44 or something of that nature. But between the ages of 0 and 44, as I mentioned, only 735 people have died. Like confirmed in that regards. So that's it out of almost 20,735. Okay. And then when you go into more details, which is the most important, no underlying illnesses. Okay. So when it comes to no underlying illnesses, only 27 people have died out of 20,000 that had no underlying illnesses that are confirmed right now. That's it. 27 between the ages of 0 and 44. That's a big block of your working population, man. And you're treating them like they're this. Most of the deaths, the vast majority of the deaths, are older people. Specifically over the age of 75. Obviously, the older you get, the more kind of conditions and illnesses you're going to have. But folks in my age group, for example, only 26. I'm between the ages of 18 and 44. Obviously, only 26 people that died, 25 in terms of age and health status. This is the fact that people completely ignore this evidence that's out there is being dishonest. Now, look, I understand that nobody likes to deal with death. It sucks when someone close to you dies. But death is a part of being a human being. None of us are getting out of this alive. And we are going through this pandemic that exists. And I think humans are going to be able to get through it. But to treat this like it's apocalyptic, you put all these people at 50, 40 million people out of work that we know of. To do that for this is insane. Stop being dramatic. Yes, in certain pockets of the country, when you look at it, and I know the goalposts have shifted. Now we're trying to save all lives. At first, it was about flattening the curve, and we know the vast majority of hospitals around the country are fine. They can handle more capacity, and that's what's going to happen. It's going to pass. It's going to go around. Lord knows if you're ever going to get a vaccine, certainly I'm not going to be the one lining up to take a vaccine that comes out this early. Y'all can do that. But when it comes to vaccines and treatments and so forth, those may never come. And if they are to come, it may not be years down the line. So it's almost as if we're all going to get this at some point. And there are going to be, unfortunately, people that are going to die. And I understand the idea of trying to limit that, being cautious, being careful, but to put people's lives on hold, or like have some draconian, not even draconian, like authoritarian mask mandate where you force people to wear a mask, as in they can't, it's illegal for them to be outside, which ensures conflict with the police, which is ironic because a lot of these people have Black Lives Matter in their posts. That's insane for something that has a 99% survival rate in the most hit part. What I mean when I'm talking about that? Scott Gottlieb new study in New York City, in New York, by Florian Kramer and team, finds that 1 out of every 5 New Yorkers likely already had SARS-CoV-2 by late April, and the infected fatality rate in New York City was about 0.7. Okay, and the study is here. I'll put that link in the pinned comment as well. I'll put all the links in the pinned comments, okay? Or the pinned comment, it will have all of this. And this is the study consisting of all of these experts. You tell us to trust the experts. This is what the experts are saying, that in the spot that was hit the hardest, the infected fatality rate was 0.7. So what that is that's what they're saying is the infected fatality rate. That's not confirmed cases versus confirmed deaths. That it has taken into account to the people, obviously, that never went to the hospital, because a lot of people are going to be asymptomatic, have very mild symptoms, never need to go to the hospital. That's what the rate takes into account. So when you consider the infected fatality rate, 0.7, that means in New York City, the place that was hit the hardest in this country, 99 is, again, that's 0.7. That's not 70, that's not 7.7% is what they're saying is the infected fatality rate. So in terms of those rates, 99.3% of people were not dying from this that had it. Yeah, we're treating this like this is an apocalyptic virus, and there people get actually offended at the idea that you say, hey man, most of us are going to be fine. There's going to be some people that get hospitalized. You're going to see people, like I say, in certain pockets of this country, hospitals that get to capacity. Some of them operating near capacity already year round. It's going to happen. This is why they have those protocols in the first place, to try to handle this. And we may have to deal with that. It seems like you're going to be a lot closer to building some sort of immunity before we ever find some sort of treatment. And ironically enough, you're actually encouraging it to mutate by actually slowing the spread. This is why a lot of epidemiologists are saying, why even do that? Why try to even slow the spread? But I'm not here to debate that. But there are epidemiologists like, why would you do that? Because you're encouraging, you're kicking the can down the road. Not to mention the deaths of despair, or the tanking of the economy and so forth. It's just, is it worth it for a virus that only kills 0.7% of the people that are infected in the most hardest hit area? Look, dudes, a lot of y'all are inconsistent. And let me speak on this mask thing on my way out. Unless you have the position of people should wear masks all the time, everywhere, unless that's your position, I'm not trying to hear anything about saving lives and mask mandates. Why? Because viruses are not new. Bacteria is not new. We spread them around all the time. We will continue to spread them around, even with the mask on, no matter how much it limits it. We spread them around. This will exist long. It's existed long before COVID-19 and will exist long after. That certain people will get this virus, be completely fine. A lot of others will get it, or a lot of other people, not this virus, let's say viruses in general. Some people, a lot of people, if not most people, are going to be fine with certain viruses, even coronaviruses. And others they're going to have a severe reaction. That can be said for things with cures and without it, with vaccines, with that. That can be said for influenza. That can be said for the common cold. One has a cure, one doesn't. Viral pneumonia, another one does not have a cure for it if it's not associated with influenza. And it will kill people. Some people get those viruses and be perfectly fine. It's just, that's how it works. So to act like, well, you are a baby killer, or, well, can't say a baby killer. That's almost statistically insignificant. I believe actually, only 12 kids had died between the ages of 0 and 17. Only 12 people had died when it comes to the New York City numbers, and only one of them had no underlying conditions. Only one. So we know those are outliers, but generally it's about the grandmas. Oh, you want people to get sick? It's like, no, dude. This is a part of life. Nobody wants to get sick. This is why it's important to build your immune system and so forth. But the whole death thing is just a virtue signal. When these guys talk about saving lives, that's not anything they'll universalize when it comes to anything else. We know there are things that even kill more. We talk about heart diseases and stuff like that. People's bad eating habits and stuff causing their deaths. Nobody's like, we should be illegal to eat certain kind of foods. Well, I won't say nobody. Some people actually are like that, by the way. But it's not about death. I know in viruses, in that case, you're talking about maybe spreading it to someone else. But I'm not advocating that people just spread it. What I'm saying is that comes with being a human being. And the only time you can really hold someone liable is if they knowingly did something, knowingly spreading it, intentionally spreading it, or being even negligent and having it and still going out and stuff like that's a completely different conversation. But that's not what we're having. You're treating everybody as if they do have it, though we're getting conflicting messages on asymptomatic spread. Some say it's rare. Some say it's less rare. We don't know, but that can be said about viruses in general. This is why it's important to take care of your immune system. And ironically enough, being cooped up inside is not the way to do that. Look, I just want you guys to make better arguments. Knowing your mom's sisters, which is your aunt, but their uncles, which would be your great uncle, I think. And they had someone at work, a work friend, who had a brother that had a wife that passed from, like, which is what that was the card the ninja tried to pull on me, basically. Not anybody he knew, of course. Generally, it's never anybody they know. It's always, well, I know somebody that knows somebody that died from this, and it's because of people like you. Like, that's kind of dramatic, man. I'm not going around encouraging that people get sick. I'm just accepting that that's part of being a human being. And if you are sick, stay at home. If you're scared to get sick, stay at home. It's really that simple. It's part of life. You go out among other people, you assume a risk. And if you don't want to assume that risk, don't get out. But it's not my job to protect you. It's not any of your job to protect me. You can virtue signal all you want. You can signal all you want. It's about taking care of others, under no obligation to do that. Under no obligation to do that, nor can you, because you cannot prove that. Look, I've seen more people touch their face because they wearing these masks than I've ever have in my entire life. Readjusting the mask and to act like just because you wear a mask, right, it gives you immunity. We wouldn't even be dealing with this if that was the case. It just gives you flat out immunity. Come on, man. What? We know that's not true. You can't prove that. People, how do you know that someone got the virus from someone that didn't wear a mask? You have no way of knowing that, because you can still contract it by wearing a mask. You can still give it to someone else by wearing a mask. Sure, it may limit it, but that can be said about virtually anything. But they don't universalize that position, and that's my problem. And because they don't universalize it, they have to make it apocalyptic and more dangerous. This should be good news to you guys. 0.7% in the hardest hit area where they never, yes, some of their hospitals are already at capacity, had some capacity issues at some point in New York City, right? They're nearly already at capacity in a lot of different cases, but you go, they had that naval or the ship that came, they had only seen like 100 and something patients, all those beds, most of which never got used. This is in the hardest hit spot. If there was going to be a prime location, right? Because New York right now, in general, has 31,000 of the confirmed cases in America, which, let me see, out of 129 deaths. So you know that Upper East Coast, that's where most of the cases in terms of deaths, that's where they're at. in places like New York City, which is the hardest hit place, and it's still only 0.7%. That should be great news for you guys, but it's not. Why? Because you got to treat it like it's an apocalyptic virus. For whatever reason, you want it to be an apocalyptic virus. And now we're having to go through all these weird sort of draconian, this is just pure authoritarian. Kicking the can down the road. Well, we have to stop this until nobody gets it ever again. What? That was never the deal. Till we get treatment. A treatment's coming. You don't know that. You have no way of knowing that. It is they say reopening too early. They always say that it's too early. Says who? The virus is gonna be the virus, man. And I get it. In some places in some pockets of the world, they don't have as many deaths. That could be for a multitude of different reasons. Are they as big as us? What's the health status of the average population? Because it's funny. Oh, you look at U.S., you look at United States, and all of these cases and deaths that they have, not understanding how many millions of people that we have out here. But, some places have done very well as far as not having that many deaths. Some people haven't. And act like, well, it's because they wear masks or because they don't wear masks, and limit it to that. It's just so intellectually dishonest, because there's a multitude of different reasons that we could sit here and discuss that could point to why that is the case. Was it worth derailing the economy? No, absolutely not. Not for a virus that seems to be a case where it's so infectious that all of us are going to get it at some point. And it seems like the immunity route is going to be way more realistic than, which is still, you be dealing with that with a vaccine anyway, but it seems like it's going to be way more realistic than waiting for a vaccine to potentially come for something that they just found out about last year. Like I said, y'all want to line up and take that and be going baby legs and stuff out of y'all's neck because they didn't think it through, or not more so they didn't think it through. It's like the trials were not clearly that long. If y'all want to do that, y'all growing baby legs out of y'all neck 5 years down the road, because nah. That's y'all's business. Y'all take y'all chances injecting that in y'all's body, not me. Not this early, at least. But on a serious note, this is great news. It's not that deadly. And we'd be doing ourselves a lot of this, even just for the sake of conversation, we'd be doing ourselves a lot more justice if we can just be honest with ourselves and actually analyze that accordingly. You can even save more lives in that regards, because this is why I say, and I'm going to end on this note, this is not just a scientific issue. Even when you talk about the whole flattening of the curve so you don't overwhelm the hospitals, that's not a scientific issue. That's an economic issue. Maybe a little bit of both, but it certainly takes in consideration the economics of it all, not just pure fact in, okay, people get sick. It's more than just that. It's economic. That's talking about allocation of resources. Scarcity is a real thing. I know that the Federal Reserve, the Treasury, gets to print money out of thin air, and maybe a lot of you guys think scarcity just isn't a thing, but it is a thing. There'll never be enough for everything for everybody to satisfy their desires and even needs. So that's why economics is important. That's what it's about. Efficiently advocating resources. And if you were able to acknowledge the reality of this virus instead of treating it like it's an apocalyptic virus, scientific, it's funny, everybody says experts, science, trust the science, when you got scientists that disagree in regards to this issue right now, as if it's just universal. Generally, when someone says trust the experts, all they generally mean is that they want you to trust their own personal experts. It's not an expert, because they're experts on different sides of this all across the country. That's what science is about. It's generally an ongoing debate. But the government ones tell you something, and then it just has to be treated as gospel. I don't even know where I was going before. Nonetheless, allocation of resources. But if you can be honest with this virus, we can actually have a discussion about allocating all of those resources and protecting the most vulnerable people. Not the folks like me. I'm generally never going to come into contact with someone that's 75 years of age older. Like I've said, I have not seen my grandma in almost half a year. My last standing grandma who just turned, I missed her 80th birthday. Why? Because I'm being cautious. So we can have that approach if we can be honest with it. There are going to be people that die. And I know it's so odd, right? Because there's a ticker and we're sitting here looking at this death count, and the more it rises, the more people start panicking as if people didn't die before, as if even some of the people that die from them, this is certainly these old people. If they didn't die from this, they was going to die from something else, probably around the same time when you consider their underlying conditions and such. So, but we look at the counter and we say, well, it keeps rising. People are dying. And we unfortunately say if the virus didn't exist, none of those people would have died about anything or in regards to anything else, which is simply not true. We know that's not how the human body works. We know that's certainly not how age and health status work. Those people would have died from something. A lot of those, considering who that target demographic is as far as who is most vulnerable. That's just the reality of the situation. With all of them? No, not at all. I'm not saying that there aren't people that are going to die, that aren't going to die. People are going to die. It's going to continue to die. But if we can be honest about who's at least the most vulnerable, that's a way we can limit the deaths, not treating everybody like we're the same. I'm going to force you because just a one size fits all, ensuring conflict with law enforcement that y'all bitching and moaning about whooping up on us. Mandate masks. So we got to have everybody in the world or in the country wear masks if they go outside of their house. But I don't have no symptoms. Oh, but you may spread it. You may spread it to someone. Well, I would have done that. I could have done that anyway. And they could have spread something to me. Still can spread something to me with their stupid mask on. That could have happened long before COVID-19 is going to happen after it. That in itself isn't saying anything. That's why the whole death thing is completely arbitrary. They don't know. It's doing what they're told. Oh, I want a signal. This will limit deaths. They told me that, the science is telling me that it can potentially limit deaths. It's an easy way to do it. So just wear the mask, idiot. Just wear the mask. You just wear it. It's just a cloth. Just wear it. What's the big deal? Just wear it. They just say that. And then because they have that position, they assume that everybody that is spreading this virus is doing it because they don't have a mask, even though we know the mask does not give you immunity, man. So why can you pin the deaths on the, as Ninja would say, no maskers? Why would you pin the deaths on them when you know the damn mask does not give you any immunity? Completely arbitrary number of deaths. But if we can be honest about this, we can get to the real. We can protect the most vulnerable. Instead of worrying about folks like myself, folks like many of you guys, there's immunocompromised folks, and there are certainly people that are old. If we were honest with ourselves from the get-go instead of treating this like everybody was impacted all the time. In the same way you had a 50% chance of living no matter what age you were. That was not the case. But they didn't approach it like that. They worried about people like me. They used their resources to shut people down, force people into their homes, or scare them into being in their homes, which put millions of people out of work in the process. And because all their focus was on everybody, which is impossible to do anyway, what happened? Nursing homes, the most vulnerable place, had breakouts. You had Cuomo actually funneling people in there. Can't even turn them away. We know they got the virus just come in like a time bomb and just kill off all these old folk. Stuff like that happens when you're not honest with who the virus impacts. That's how stuff like that happens. My argument has been the same. If there was going to be a quarantine effort, it should have been to the most vulnerable. Not for folks like myself that find this unnecessary. And if you were scared of getting it, you should have stayed your ass at home. Still remain to stay your ass at home. Because what is not a new risk is you going out and potentially getting a virus or some sort of bacteria or something like that passed to you that may impact you severely. You know your own health status. And it may impact you severely, and there may be some outliers, right, of like 27 people that may have no underlying conditions that have a reaction as such that ends up killing them. But those are statistical outliers, and we should treat them as such. So be honest with yourselves, guys. That's all I'm asking. This is a 30-minute video. I'm just trying to break it to you guys. And I know I said stupid mask, but I want to be clear. I'm not anti-mask, by the way. What I'm saying is a mandate is insane. Unless you are, well, it's insane regardless, but you'd have more of a leg to stand on if you were advocating to force people to wear masks for the rest of their lives. Otherwise, you have to admit that the death is just completely arbitrary number, because you certainly wouldn't have every flu season, or as these common colds get, the coronaviruses and things that have no even like, let's say, cures, right? Things with and without vaccines and treatments, different forms of treatment, could potentially get you sick. And you could pass that to other individuals who may have not had any reaction. That's not new. Don't pretend like that's new to COVID-19. This may be more infectious than a lot of them, but don't pretend like this is new to COVID-19. This is not. That's going to happen before, and it's certainly going to happen after. So the mask thing only makes sense. You only have a leg to stand on if you were advocating that year-round for the rest of our lives. Otherwise, you're just signaling. You're just talking. You're just talking. This thing has 99% survival. You're just talking. That's all. You're just talking. Let's be honest with ourselves and let's have an honest conversation. Oh, there's one more bit I have to address. There are long-standing effects that happen with lungs and stuff like that is another thing. Do you not know that can happen with a cold? Again, something not new to COVID-19, but we treat it. Oh, well, these might have other long-term effects, even though that's not what all the data shows. So most people that are recovering for the most part are good. But there may be some outliers that may have some scarred up lungs or something like that because they hacking and stuff. That's not, again, unique to this virus. It's not. That can happen with a multitude of different respiratory diseases and sicknesses that people get every year. But again, we're acting as if there's just so concrete that that's going to happen to everybody, when there's nothing that points to that direction. Not yet, at least. Let's be honest with ourselves, and y'all quit being dramatic, man. Golly.